Welcome to the Family Information Session for the Family Center for Weight and Health. We are located at the Cypress Regional Hospital in Swift Current, Saskatchewan. In the next 20 minutes, you will learn about our team, discover what we do, learn about your family's journey, and learn about your family's next steps. You may be here because you want to feel better or more confident, understand more about health and weight, help your child keep up in gym class or on the playground, how to make healthy food choices at home and when eating out, or have more energy, or understand and address any of your child's weight-related health concerns. A multidisciplinary approach is the best way to help your child and ensure that the best care is provided. Let's meet our team. Cindy works with primary health and the midwifery program. She takes care of contacting families for appointments, sending letters, and keeps us organized. She's available to answer your questions about the program or direct you to someone else who can. Dr. Fokker is a pediatrician on our team. He spearheaded this clinic a few years ago. He's passionate about working with kids and families to help them achieve their best lifestyle possible. He will take your child's weight, height, and blood pressure and review their medical history. He may request further blood work to assess for conditions affecting your child's weight. He will work together with your family physician as needed. Sarah is a psychologist with child and youth mental health. Her role is to meet with all families and help with any concerns regarding your child's mood, self-esteem, and to help support potential lifestyle changes. She can help you connect with other supports if needed. Lindsay will work with you and your family to assess food intake and ensure your child is meeting their nutritional needs. She may make some suggestions to improve your child or family's diet, but rest assured, she is not the food police. Michelle is a physical therapist. She works with kids of all ages. She will ask you about you and your child's physical activity patterns and find out which activities they enjoy. She will also ask about your child's sleep habits and screen time.
Your doctor or nurse practitioner may have measured your child's height and weight or talked about your child's growth. You may have been told that your child's weight is higher than expected for their height and age. We use growth charts for height, weight, and BMI to determine this. Growth charts allow us to compare kids to others of a similar age. This doesn't mean that your child is unhealthy, but it helps us identify those at risk for health problems. There are many possible causes of increased weight, and we are here to help identify these and treat them. The endocrine system controls hormones. Endocrine disorders can affect metabolism. For example, there are two particular hormones that affect hunger and fullness. Your genetic makeup can affect your weight. Sometimes there may be a problem with a specific gene that can affect a child's growth or appetite. There are also a few rare genetic syndromes that can cause obesity. Genetic testing is sometimes recommended. One of the roles of the central nervous system is to regulate metabolism and control appetite. Problems with the nervous system can cause increased appetite or decreased energy expenditure. Acquired obesity makes up 95 to 97% of cases seen in Canada. This is when there may be no other medical reason for obesity, but lifestyle may be a factor. We are well aware that obesity is caused by much more than a poor diet and inactivity. Keeping this in mind, a healthy diet and physical activity can help reduce risk of future complications of obesity. This is why we do spend quite a bit of time on these topics, so we can help your family achieve their best health and well-being. These are some of the problems that may be associated with excess weight. Low self-esteem, being bullied or feeling down, early signs of type 2 diabetes like high blood sugar, early signs of heart disease like high cholesterol. When our weight is higher, fat is deposited around our organs, which can lead to liver problems. Blood tests can identify whether our liver is under stress. Sleep and breathing problems like sleep apnea, menstrual problems in girls due to unbalanced hormones, skin and joint problems like rashes or joint pain. Although these conditions may not be common, these are things we do screen for. Unhealthy weight is considered a chronic condition, but you should know that you and your family can lower these risks. We focus on health, nutrition, physical activity, sleep, and relationships. Although not the focus of our clinic, weight loss may occur. One of our goals is that families learn to make and maintain healthy lifestyles. How do we do it? Each family is unique and different. We will meet with you to see what your family's needs are, using a non-judgmental approach. We value family-centered care where the entire family is involved. That may mean just your immediate family, but can also include extended family members such as siblings and grandparents. Our focus is on improving your child's health rather than on weight loss. We want to help you identify areas for improvement and make gradual, sustainable lifestyle changes. We recognize that weight management is complicated, and it's not just about eating less or moving more. If your child does have any medical conditions related to weight, we want to help you address them. Mental health's role is to assess children and families' functioning in a variety of areas, including mood, self-esteem, and family concerns. We support the child and family in setting realistic goals and identifying and overcoming obstacles in the way of a healthier lifestyle. We are able to meet alone with parents to support them in making changes, and we can refer and link families to community programs if needed. You might be thinking, why is there a focus on parents? We strive to work with families as a whole, but often it is you, as a parent, who can influence the most change. You are the family leader and your child's main role model. It is difficult for a child to change on their own, therefore we advocate for change at the family level. Each day you have the opportunity to influence your child and your family as a whole. Mental health means striking a balance in all aspects of your life. This includes things such as your emotional, social, mental, and physical health, among others. This balance is unique to each individual and family. Mental and physical health are closely linked. Healthy eating and exercise are beneficial for both our mental and physical health. Physical activity and exercise can help improve self-esteem and often reduces mental health concerns such as anxiety and depression. We support families in finding their strengths and identify areas where your level of mental fitness could be improved.
One of the first changes you can make is to follow the healthy plate. Include 3 to 4 quality food groups per meal. Try to fill half of your plate with vegetables, 1/4 of your plate with grain products or carbohydrates, and 1/4 of your plate with meat and alternatives, such as beans, eggs, and nuts. The more home cooking you do, the better, but this plate method for portions also works at restaurants and your grandma's house. Consider having a glass of milk or water with your meal. All foods can fit in moderation. Try to think of foods in these different categories. Go foods. These foods contain many nutrients. These are foods that help you grow. Try to fill up on these foods for meals and snacks. Yield foods. These foods contain some nutrients but have added sugar, salt, and or fat. These foods may still be considered healthy but should not make up the majority of your diet. Stop foods. These foods are high in sugar, salt, and or fat. These foods are treats and should be eaten on special occasions. They should not be part of your daily diet. A little bit on serving sizes. We all love pasta, but just how many servings of grain products are in a 2-cup portion of pasta? Is it 1, 2, or 4 servings? The answer is 4 servings. 1 serving of pasta is equal to 1/2 of a cup. Most people eat more than 1/2 of a cup at a meal. That amount is the portion size. In this case, the portion would be 2 cups and the servings would be 4. For an average 8-year-old who needs about 4 servings of grain products per day, this meal would meet the requirements for the entire day. Try to think of pasta as a side dish, not a main dish. Remember the healthy plate method and fill 1/2 of your plate with veggies and try and keep pasta and sauce to the other 1/2 of your plate. How many servings of grain products do you think there are in a 12-inch Subway sub? I'm thinking more about the bun rather than the insides of the sub, so think of your own favorite sub. Is it 2 servings, 4 servings, or 6 servings. You might be surprised to hear that a 12-inch sub is equal to about 6 slices of your average sliced bread, which would be about 6 servings of grain products. Consider having a 6-inch sub instead and having fruit on the side instead of a cookie. Here's some ideas to get you started eating healthier. Reduce or cut out sugar-sweetened beverages like pops, Slurpees, and sports drinks, as these contain lots of sugar and usually no nutrients. They can definitely add up throughout the day, so choose water and milk as often as possible and limit sugar-sweetened beverages for special occasions. Even fruit juice, though it may come from fruit, still contains lots of sugar, so consider limiting it too. Have vegetables and fruits every day, preferably with each meal and snack. This sounds overly simple, but veggies and fruits contain tons of nutrients and are a good source of fiber, which is filling. It's hard to overeat apples and oranges, but easy to do so with chips and chocolate. Eat at home more often. Food in restaurants is usually rich in fat, sugar, and salt, not to mention the portion sizes are often much larger than we need. Most restaurant meals meet or exceed your daily requirement for salt. So check your favorite restaurant's website for nutrition information to find a lower calorie option or share a meal with someone. Better yet, cook at home. And eat together as a family. Research has shown that up to 1/3 of families seldom eat together. There is a link between eating together and significant health and social benefits for children and adolescents. Pay close attention to portions. Like we've already gone over, servings can add up quickly, especially on some of our favorite foods. You don't have to avoid those foods entirely, but be careful not to take too much. Use your hands to estimate portion sizes. Your fist is a good portion for grain products and carbohydrates. Your palm is a good portion for meats. And imagine scooping up veggies in both of your hands. These are just a few of the things you can do to begin making healthy changes.
In 2016, Participation teamed with various agencies across Canada to study physical activity, sleep, sedentary behavior, and screen time habits of children and youth 5 to 17 years of age across Canada. Results of those studies showed that only 9% of kids were getting the right amount of moderate to intense physical activity, and only 24% were meeting screen time guidelines of 2 hours or less per day. 31% of school-aged kids and 26% of youth were considered to be sleep deprived and not getting the recommended amount of sleep for their age. As a result of these studies, a 24-hour movement guideline was created and released in the spring of 2016. The goal is for Canadians to achieve the right balance of sweat, step, sleep, and sitting behaviors. The green section located on the far left-hand side is sweat. Current recommendations include 60 minutes of moderate to vigorous activity at least 3 days per week. A variety of different activities is important for heart, muscle, and bone health. The orange section of the diagram is steps. This section includes light physical activity, both in a structured, something formal and scheduled, and unstructured time, such as free play time after school or work. This can include going for a walk, going for bike rides, or playing at the park. It can even include yard or household chores. Sleep is the largest purple section of the diagram. Sleep is a newer focus area in recent months as research has found that children, youth, and adults were not receiving optimal hours of uninterrupted sleep. Current guidelines recommend 9 to 11 hours for children between the ages of 5 and 13, and 8 to 10 hours for youth between the ages of 14 to 17. Consistent bed and wake times, as well as a comfortable sleep environment, all help to achieve a good night's sleep. The last category is SIT, or sedentary behaviors. Recommendations are for no more than 2 hours of screen time per day, with limited sitting for longer periods of time. This means that playing a board game or reading a book are still good, however, longer activities should be broken up with movement. When we have a healthy balance of sweat, step, sleep, and sit, we can expect improved heart, lung, and muscle fitness, improved academics for kids, improved emotional regulation and positive connections, and overall improvement in quality of life. In the summer of 2016, Pokemon Go, a location-based virtual reality mobile game, was released and took the world by storm. The idea behind this active video game is to catch as many Pokemon as possible by walking. People like myself are debating whether Pokemon Go is the newest fitness craze out there, and if it is powerful enough to create lasting behavior change to help Canadians to sit less and move more. Since its release, we have seen and heard many stories about the positive impact it's having on people. People are talking more about getting active, moving more to increase their daily step count, and getting active outdoors and exploring new areas in their neighborhoods. This game adds steps, but not necessarily sweat, and because it still involves a screen, time playing Pokemon Go is still screen time. I'm sure that as time goes on and more games like this will pop up, guaranteed it will be researched to determine if there will be a positive or negative effect on health. The take-home message for kids, youth, and adults: don't trade your soccer balls for Pokeballs. In a 24-hour period, we should spend the most time sleeping. As mentioned earlier, we know that children and youth are not getting enough sleep. What's so important about sleep? Too little sleep can cause hyperactivity, impulsiveness, and a short attention span. It can create kids who struggle in school, increase the chance of struggle with obesity, diabetes, and high blood pressure, and long-term sleep loss can even contribute to mental health concerns. If a lack of sleep is a problem for your child or yourself, the good news is that small changes can be made to help get a better night's sleep. Some helpful tips include keeping TVs and electronics out of the bedroom. Screens before bed can interfere with your ability to fall asleep. Make sure your child is getting some heart-pumping activity throughout the day. More physical activity is good for your health, and we know that an active kid is a tired kid. The same applies for youth and adults. Get your kids outside. Being outside means that you and your child are more likely to get in some extra physical activity. Consistency is key. Encourage consistent bed and wake times. There should be no more than 1 hour's difference between weekday and weekend sleep and wake times. Structured time can help kids settle into a routine and allow them to be better prepared to fall asleep and wake up naturally. Be a good role model. Walk the walk by getting enough sleep and integrating physical activity into your own life.
In 2012, the Cypress Health Region teamed with various community agencies and partners in education to create a Child and Youth Wellness Coalition. In 2014, this working group conducted a study of children 4 to 17 years of age. They looked at average daily intake of fruits, vegetables, water, milk, fruit juice, carbonated beverages and restaurant meals, physical activity and sleep habits, screen time, health conditions such as asthma, allergies, and diabetes, prescription medication use, and breastfeeding during infancy. 246 kids participated in the study, and results showed that 1 in 3 children were overweight, 1 in 5 kids were considered obese, and 1 in 17 were considered severely obese. Results for the study are shown on this graph. Green bars suggest that most children are doing well in these areas, while yellow and red bars point to potential priorities for our communities. Children and youth studied struggled the most when it came to eating fruits and vegetables, limiting screen time, and getting enough sleep. On the other hand, most children rarely consume sugar-sweetened beverages like pop, and most ate breakfast regularly. In general, these indicators of healthy living got worse with age. Rates were lowest in teens in all areas with the exception of sleep. So if you're interested in taking part with our clinic, here's how you get started. We've already received a referral, and this is the family information session. You may have received or will soon receive a package by mail, which includes a questionnaire and requisition for blood work. The questionnaire provides us with your child's medical history and some basic information, including a 3-day food and activity record. We would like these to be 3 average days, not days where you are on vacation or your child is sick. The more detail you provide us, the better we are able to help you. The blood work will help us screen for some of those health concerns we mentioned earlier. We will allow you 6 weeks to return the questionnaire and complete the blood work. If we haven't received either and haven't heard from you, we will assume that you're no longer interested and will send a letter to your physician. If you require more than those 6 weeks to complete these items, that's fine. Just give Cindy a call and let us know. When we receive your pre-appointment questionnaire and blood work, we will schedule your child and family in for an initial assessment. Our clinic is at the Cypress Regional Hospital and runs on Tuesdays once a month. Our hours are from 9 a.m. to 3 p.m. During your first visit, you will spend 30 to 45 minutes with each clinician. We will invite you back in 1 month to meet us as an entire team, review the initial assessment results, and develop a care plan with you. If you choose to continue, follow-up appointments may only be 30 minutes, and you may not see each of us at each visit. Your family can identify areas in which you would like to focus, and we will help you in those areas. Follow-up will be arranged to suit the needs of your family. A program typically lasts for about 2 years. At that time, we will discuss your child and family's progress with you and whether you require further support. If you choose to enroll in the clinic, we do have a few requests of you. We ask that you attend all scheduled appointments or call in advance as early as possible if you are unable to attend. We ask that you complete all homework, including blood work and questionnaires. We suggest that you work together as a family to make changes. We cannot expect children and teens to work at this alone. Families who work together tend to have the best outcomes. So if you're ready, complete your questionnaire and blood work. If you're still thinking about it, let us know that you want more time to consider it. And if you're not ready or do not want to enroll, that's totally fine. Just let us know that you're not interested. If you're interested in joining the clinic, we do look forward to meeting you. If you have any questions about the program, please don't hesitate to call Cindy at 306-778-5118. Thanks so much for your time.